Hi, everybody, and welcome to the Dr. Psych Mom Show. Today, I'm going to talk about the Lindsay Clancy case and what I think about it. And before I do that, I will tell you to subscribe. My most recent subscriber episode was on when you struggle with wanting your partner to change back to who they were at an earlier stage or what you thought they were. And that is very relevant for a lot of people that listen to this podcast and who struggle with different issues in their relationship, which are usually change. People struggle with change a lot, especially when they perceive that there's only been change in their partner and it's only bad change. And so that's a good episode. And of course, if you subscribe, you get about 230 other episodes, which is great and really a lot of content, if I do say so myself. Okay, so the Lindsay Clancy case, it's been all over the news. If you haven't heard about it, she murdered her children, her 3 children and young children, including a baby. And then she tried to commit suicide, jumped out the window. She broke her leg. She's paralyzed. It's a heartbreaking case. And the two sides of it are, was she an intentional murderer that should go to prison, or did she have postpartum psychosis and so therefore should go to, get her to a mental health inpatient facility so that she could be treated, etc., and not go to life in prison. And my thoughts as a psychologist and as a mother are, it's almost kind of crazy to me that the case is happening at all. It's so obvious to me that she had postpartum psychosis, though you could follow the case if you want. She was on a lot of meds. She was trying to get treated for postpartum depression. She had terrible anxiety. She wasn't sleeping. She had this history of trying to get help. She tried to reach out to suicide helpline. She tried to get an inpatient. She tried to go inpatient or partial hospitalization. She was trying to do anything she could. She was on a bunch of meds, and that's basically there. She and her ex-husband are also suing the healthcare that they receive, the hospital and psychiatrists and what have you, for potentially mismanaging her case. The point is it's heartbreaking. It's almost kind of crazy to me that anybody would think that a woman who would do that was not in the throes of postpartum psychosis. I think that's definitely what was going on. If she was, who would do that, right? Except somebody who was in a psychosis. She also tried to jump out the window. So I don't even really see how there's another side to this that says that this was some sort of premeditated thing. Everybody that they called said she was such a good and assiduous mother. And the baby was 8 months old. She was experiencing postpartum depression, which is very common. And postpartum psychosis is much less common, but it still happens in about 5 of every 1,000 cases. I think that what's happening from this case is a huge shift in awareness about postpartum disorders. And that's wonderful. So many women struggle with postpartum depression, anxiety, OCD, very few with psychosis, but obviously that happens as well. And there's a case every few years like this. Remember years ago, there was the one where the women drove her and the children into a lake or something in the car. Whenever anybody is feeling this desperate, they're obviously in the throes of some sort of psychosis. I just watched this great series on BritBox called Time. It was about prison. The first season was a men's prison, but the second was a women's prison, and the main character was fictional, but the main character had a similar thing happen, postpartum psychosis, and she killed her baby. And all these women were blaming her until she told her story in a meeting. And then basically they said it could have happened to anybody who was experiencing that severe of a mental breakdown, where you're very paranoid and you can't stop your mind from racing and you're not seeing reality, right? And people don't know exactly what was going on here with Lindsay Clancy. It seems that she had some sort of bipolarity that was maybe triggered by some of the medications, which can happen if you get on antidepressant. You've never been diagnosed as bipolar, but if you have that underlying predisposition, then if you get on an antidepressant, then it can trigger mania. And mania isn't just euphoria, it's agitation. It can get into the level of psychosis and paranoia. So the point is that the after having a baby period, postpartum, is like really, really mentally destabilizing, mentally and physically destabilizing for women, and for their entire self can feel like it's just not there anymore. You're just completely focused on the baby. And it's adaptive to have this hyper focus on a baby so that you care for it. But in some cases, right, the whole system can be diverted, like it can go into overdrive. And then you're obsessed. You have these intrusive thoughts of potentially harming the baby and potentially harming yourself. And so many women are terrified and ashamed to reach out for help because, and I have posts about this dating back years, the biggest taboo is feeling like you don't love your baby, right? And because that means you're, quote, a bad person or a bad mom. No, it doesn't. It means that you're probably have postpartum depression or postpartum anxiety or some postpartum issue, some sort of trauma, to the system. Having a baby, being pregnant overall, it changes you. It changes you physically, it changes you mentally. Then you have the baby. Your hormones are completely in flux. And as I've discussed many times, women's mood is yoked to their hormone fluctuation, for example, over the course of the menstrual cycle. The postpartum period is extremely volatile in terms of what's going on in your brain and your body. And sometimes things tick over into something that's more psychotic. Thankfully, this is very, very rare. But it does come from this, it was almost like she wasn't in reality, I believe, And so the postpartum was trying to be treated, the postpartum depression, they didn't treat it. Who knows how they treated it? Obviously, nobody here was trying to have a terrible outcome. The psychiatrist was trying the best they could. The nurse practitioners, there was a lot of people involved in this. Everybody was trying their best, I deeply believe, as a healthcare professional. And it's just a horrible, cataclysmic, heartbreaking situation. And it's increasing awareness massively for how common this is, the postpartum issues overall, not the psychosis again, and how you need to reach out for help, which she did, but you also, and this is super key, you can't be alone with the kids if you're having these kind of thoughts. And of course, this is easier said than done, right? Because many people don't have family support. Now, Lindsay Clancy did. At some point, she was like really not doing well, and her parents moved in. Her husband worked from home. There was babysitting help. Some of the kids went to a daycare, but she did still feel very, very stuck in these ruminative loops about the baby and about the kids and about herself. And the one thing that I would say is extremely important to recognize from this is if you have thoughts like that, you have to kind of tell everybody. You have to tell your spouse and you have to tell your healthcare provider, and you can't be alone with the kids if you have these thoughts. And that's important. And it doesn't mean that you're a bad parent at all. A good parent, the best parent is the one who protects the kids. So if you have to protect the kids from yourself and what's happening in your mood internally because of the hormonal switch in the postpartum period, then that means that you're a good mother. If I've worked with so many women, and this is the most kind of fulfilling cases that I've had. I've worked with multiple women over the years that have struggled with this feeling like, and Lindsay Clancy didn't say this, but this is things that people have said to me because I wrote that post of like when you can't bond with your baby. I wrote years ago, so people reached out and they would say that they felt so terrible and shameful, until they read my article on how normal it is to feel like you hate the baby, or you can't bond with the baby, or you don't like the baby, or you shouldn't have been a mom, or this isn't for you, or you ruined your life by having a baby. All these things are super common if you're experiencing postpartum depression. And so it's the postpartum depression that's making you feel that way. It's nothing about like you and your core character. It doesn't make you a bad person. In fact, if you can continue to be, act like a loving parent, then you're an even better, more awesome parent because you're doing it without having those feelings. Eventually, those feelings come back, right? So there are treatments for postpartum. In fact, there is this treatment. It was interesting in the case. I never watch court TV, basically, until this. But there's this zernanolone new infusion of these neurosteroids. This is a new treatment for postpartum, by the way, where you have to go to the hospital and you get this infusion for 72 hours or something. I may have those hours wrong. But anyway, it's this totally new treatment for postpartum. But the reason I like this treatment so much, the idea of it at least, and Lindsay Clancy did not end up getting this. That was some of what her lawyer was saying is why did the psychiatrist just look this up, but not further make sure that she got it or whatever. And of course, the healthcare system is so messed up. And this woman has she didn't have hospital privileges at this place and she didn't know how to get it. I don't know. There's a lot of complexity in this situation. And it is really interesting to see kind of how our healthcare system looks to anybody listening to this case. It looks crazy. There's just people are overworked. They're dealing with multiple patients every day in these hospitals, and they're having the patient portal messages. I mean, it's the healthcare providers are super tapped out, and it's kind of crazy to see how there was one ridiculous interaction where he's you said that her mood was incongruent, and she's well, you have to click that on the box in order to get to the next screen, and he's are you a robot? Can you only click boxes? Can't you write a note with a pen? And so he's trying to make the psychiatrist look ridiculous. But the reality is that she works for a big healthcare system and they don't have paper notes and she isn't allowed to do that. And so there's something really broken in the healthcare system where people do fall through the cracks, and it isn't the fault of any individual provider. But that's, a discussion for another time, my perspective on that. The point being that this zernanolone thing, what I was saying is when I first heard about it, which was not in this trial, it was before, I was well, why this is great, I thought, is because the woman takes 3 days in the hospital. So basically everybody around her understands this shit is very severe, what she's going through, and we need to have alternate care for the baby for these 3 days. And you know what? Then maybe we need alternate care after that too. And so it can be kind of this wake-up call to the entire family, the spouse, and anybody else who's around, that this person really, really does need help and that this is severe. And sometimes that's what you need to make sure that, obviously this couldn't have happened if there was somebody in the house, all the time, like a live-in nanny. And I know everybody cannot get a live-in nanny, but people who can't, the parents could have stayed for longer. Who knows? Nobody knew what was going to happen. I feel terrible for every single person involved in this, but what we want to take away from it is that if you are experiencing postpartum depression, anxiety, OCD, psychosis, anything like that, talking to your provider about it is the best way to be a good parent, and advocating in any way that you can to say, I can't really be alone with the kids. Almost no spouse, no matter how, busy, avoidant, not caring about mental health they are, could really say something to that. It's okay to say that. If you're feeling really bad and you feel you can't be alone with the kids, that's the words that you need to say. It's, I can't be alone with the kids. I can't take care of the kids now. And moms don't want to say that. They really don't want to say that because there's so much stigma to being a, quote, bad mom. But those are kind of the words that you have to say. And you really need to kind of advocate for yourself because you're really advocating for your children. So sometimes we need to protect our children from our own mental health issues or our own limitations or our own, hormonal variations that lead to these sorts of, issues like postpartum issues. And that makes you a good mom. getting treatment and admitting that you're struggling makes you a good mom. That makes you protect your kids so much more down the line. Sometimes we have to protect our kids from ourselves. That's real. If you're struggling, you do have to do that. And so it's super shocking, honestly, that this has taken this long to be in the public discourse, but it's really an unintended, useful byproduct of this horrible, horrible situation that every day a lot of people are tuning in to watch this and to learn about postpartum issues and how cataclysmic they could be if they're not treated and if they're not taken seriously. So talk to your doctor, talk to your therapist, talk to your any sort of healthcare provider. There are suicide lines, 988, and there's even a special postpartum mom support line. I'll put that in the episode description. Obviously, you could reach out to my practice as always, but there are, when people are really struggling, they need to talk to somebody right away. That's when these hotlines are really good. And unfortunately, in this case, it seems that, she did try a lot of these things, and for various reasons, she was turned away or she couldn't get into programs and so forth. I don't know, obviously, every fact of the case, but it is something where the louder and more vocal you are, as with anything, about how much you're struggling, the more likely you are to get the help that you and your children need. It's a totally crazy situation internally in your brain and your body to have a baby, and sometimes things short circuit, and that's nobody's fault. All right, I hope you guys got something out of this, and I will talk to y'all soon. Have a great day.